In this video, we'll do an exam review on optic pathway and optic nerve lesions. So each eye is divided into two halves, a temporal half and a nasal half. The temporal half fibers have the nasal visual field fibers and the nasal visual fibers have the temporal visual fibers. These temporal visual fiber and the nasal fibers they pass backwards to the optic chiasma where the nasal fibers decussate from both sides, whereas temporal fibers don't decussate. So, if there is a lesion of the optic nerve before the optic chiasma, so what type of lesion it would cause? It will cause complete blindness in the ipsilateral eye, in the same eye, with loss of light perception. We'll do the light perception later in the program. But if there is an incomplete lesion of this optic nerve before the optic chiasma, say for example that involves the temporal fiber that represents the nasal visual field, what type of lesion it would cause? It would cause blindness in the nasal visual field of this eye. So this is the right optic nerve. So if there is a interruption of the temporal fibers, so there will be ipsilateral nasal hemianopia like this. So the fibers they decussate in the optic chiasma and cross over. So the fibers of the temporal side, the nasal visual field, they remain ipsilateral, but nasal fibers cross over and come over to the optic tract. So what happens if there is a lesion in the optic chiasma? Both nasal fibers are decussating. They represent the temporal visual field. So that causes bitemporal hemianopia, or that involves and causes blindness in the right side of the right eye and the left side of the left eye. So that's also known as heteronomous hemianopia, right? So when does it occur? The bitemporal hemianopia. So where is anatomically the optic chiasma? This is the pituitary gland. And where is it? It's in the sella tracheica of the sphenoid bone. And optic chiasma is above the pituitary. And this pituitary is connected by two connections to this one. Above this is hypothalamus. Two tracts, one vascular and other one is neural. The vascular tract is hypothalamo-hypophyseal portal system of veins, like the portal system of the liver. And they bring the release hormone from the hypothalamus to the anterior pituitary for pituitary hormone, TSH, RH, ACTHRH, LHRH, and FSHRH. So all these, and they also bring the prolactin inhibitory hormone. Whereas the posterior pituitary is connected to the hypothalamus through the neural tract, hypothalamo-hypophyseal tract. What type of hormone they bring? They bring the two hormones, oxytocin and vasopressin. Pituitary doesn't make them. They are only stored in the pituitary. They are made in the hypothalamus. What are the function of these two hormones? Because they produced in the brain, in the hypothalamus. Before we discuss it, let me see that what happens here, that this optic chiasma is here above the pituitary. So a tumor, pituitary tumor, like a growth hormone tumor, will interrupt the fibers, nasal fibers, which represents the temporal visual field of both eye, and that would cause this type of bitemporal hemianopia. So these two hormones, oxytocin and vasopressin. Vasopressin, other name is ADH. So what's the function of the ADH? ADH maintains the blood volume and blood pressure. How does it do that? ADH causes water reabsorption from the DCT and collecting duct. So in the absence hyperosmolar, and the blood volume will be reduced to less than 200 milliosmoles. There is a condition also known as SIADH, syndrome of inappropriate ADH production. That's increased ADH that will cause more excessive water reabsorption kidney. So urine become less in amount and the blood volume and serum will become more in amount. So the osmolality of the body fluids will be decreased. Whereas the other hormone, the oxytocin, has different functions at different physiological states of the body. Normally, oxytocin causes at puberty development of the breast. The ductal development of the breast. But at the time of labor, it causes uterine contraction by increasing calcium in the myometrium, and that causes uterine contraction at the time of labor. And also after the labor, it prevents bleeding. It's also involved in milk ejection at the time of lactation. And how does it do the milk ejection? Suckling baby, when he suckles the nipples, it stimulates the mechanoreceptors. These mechanoreceptors stimulate and produce the oxytocin from the pituitary. And that oxytocin acts on the myoepithelial cells of the breast, causing contraction, causing milk ejection. So oxytocin has nothing to do with milk production, but it causes milk ejection. Whereas if you see here, suckling causes a stimulation of mechanoreceptor, and it also stimulates the production of prolactin. Dopamine is inhibitory to the prolactin. So this mechanostimulation causes prolactin production from the pituitary, and that acts on the milk gland of the pituitary and produces milk synthesis by combining casein and lactalbumin. So what's important about the prolactin is that prolactin is also involved in the LH surge. So if there is an excess prolactin, hyperprolactinemia, or pituitary adenoma producing excessive prolactin, that inhibits the ovulation, because excess prolactin causes or inhibits the LH surge, and LH surge is required for ovulation. If excess amounts of prolactin is present, it causes anovulatory cycle that causes infertility. So excess prolactin is an important cause of infertility. Now let's go back to the optic tract. So what type of fiber? This optic tract starts from after the optic chiasma and then end up in the lateral geniculate body. Lateral geniculate body is a part of the thalamus, and the fibers here are the temporal fiber from, if in the right optic tract, temporal fiber representing the nasal visual field, and the nasal fibers of the left eye, which represent temporal visual fields of the left eye. So a lesion of the optic tract, what it will cause? It will cause blindness in the opposite half of both eyes. So the right optic tract lesion will cause blindness in the left side of both eyes here. This is right optic tract lesion that causes blindness in the left side of both eyes. This is known as contralateral on the left side of both eyes. So this is known as homonymous hemianopia, contralateral homonymous hemianopia. So lesion of the optic chiasma caused bitemporal hemianopia, that is heteronomous, but this one is homonymous. Left side of both eyes get a blindness in a lesion of the optic tract, and the optic tract lesion. This is a blindness in the left side of both eyes. So this is a lesion in the right optic tract, and this one here, blindness in the right side of both eyes. So this is a lesion in the left optic tract that causes right-sided blindness, homonymous hemianopia, and this one, which causes right side optic tract lesion, homonymous hemianopia.